All right, you are dispatched to a single-family residence for chest pain.
Okay. The PPE is on for my team and I. Is my scene safe?
Yes.
How many patients do I have?
1.
Where's my nearest hospital?
Hospital's going to be 10 minutes away.
Okay. Nearest ALS?
45 minutes away.
I'm going to consider the need for C-spine at this time. I'll determine if that's necessary or not.
Okay.
And you said my call was for chest pain.
Correct.
Okay. As I approach the patient, hey man, my name is Carrie. I'm with Hall Ambulance. Did you call 911 today?
Yeah, my chest is really killing me.
Your chest is hurting? My patient's airway is patent because he's speaking to me. Are you able to breathe okay, sir? You having any shortness of breath?
No, I mean, maybe a little bit, but my chest just hurts.
Okay. Can you tell me what year it is right now?
2021.
Okay. What city are we in?
Bakersfield.
Okay. And how many quarters are in a dollar?
4.
And who is our president?
Biden.
Okay. My patient appears to be alert north times 4 at this time. His radial pulse is present. I have a pulse rate of 76. What's my scenario?
You get 102.
102. I'm going to check my patient's blood pressure. And I'm also going to check my patient's oxygen saturation.
Okay.
His respirations appear to be non-labored at this time, and I'm getting approximately 16 breaths per minute.
Okay. Your respiratory rate is 20.
My respirations are 20. My oxygen saturation appears to be 98. What do I have for my scenario?
93.
93. Because he's at 93% and he is having chest pain, I want to put him on a non-rebreather mask at 15 liters.
Okay.
Pediatric. Non-rebreather mask at 15 liters per minute for my patient.
Okay.
And I'm going to go ahead and check his blood pressure at this time. My blood pressure for this patient is 210/106. How is my non-rebreather mask working for this patient? Is his oxygen saturation getting better?
Yes, his oxygen saturation has come up to 98%.
Okay, so he's at 98% and he's still, is it 20 breaths per minute still?
It's dropped to 18.
18 breaths per minute. Okay, so respirations are secured at this time. I'm not going to worry anymore about airway. And I'm going to move on with this chest pain that my patient's experiencing. Sir, with one finger, can you explain to me where this chest pain is occurring?
He points to the upper left side of his chest.
Upper left side of the chest. And does that chest pain radiate anywhere?
Yeah, it moves down to his arm.
Down to through the arm?
Yes.
Okay. Does it, is it a crushing pain, dull pain, burning? Describe it for me.
He says it feels like something is sitting on his chest.
Okay, sitting on his chest. It's a heavy pain?
Yes.
Okay. Sir, I'm going to ask you if you have any medical conditions that I should be aware of.
He's had a heart attack in the past, and he's got atrial fibrillation, and that's pretty much it.
Okay. Any allergies to medications?
No.
And do you take any medications?
Yeah, he takes a baby aspirin every morning, and then he's prescribed nitro, and he takes something for his AFib, but he can't remember.
Okay, because he's super hypertensive at this time and he is experiencing chest pain, a couple more things before I give him any medications. I just want to make sure, sir, when I press on this area, does that pain get any better or worse?
No.
Okay, and if you take a deep breath in, does that pain get any better or worse?
No.
Okay, so no change in that chest discomfort with palpation and or deep breath. So I'm going to go ahead and administer 4 81 milligram aspirins to this patient. But before I do that, I want to make sure, do you have any recent GI bleeds that I should be aware of?
No.
Okay, do you have any asthma?
No, he does not.
Any recent surgeries?
No.
Okay, so I want you to chew and swallow these 81 milligram aspirins. It's going to be a little bit thick, but I'd rather you not swallow them whole just so they can absorb and work faster. So
Okay.
after the aspirin, I'm going to recheck my patient's blood pressure if I could please, as well as his pulse.
Okay. Come up here in just a second. Your blood pressure comes back at 200/124.
Okay, so my blood pressure is still pretty high. How's that chest pain feeling, sir?
It went down a little bit, but it's still there.
Okay, and you did say you are prescribed nitro?
Yes.
Okay, have you taken any of those today?
I have not.
You did not take any? Okay. With your nitroglycerin, I just need to make sure, did you take any erectile dysfunction medications in the last 72 hours?
No.
You did not. So we're going to go ahead and place one of those nitro tablets underneath your tongue and let that dissolve. Once that's done, we'll wait about 5 minutes and recheck this patient. At the 5-minute check, is he still hypertensive?
Your new blood pressure comes back at 152 over 76.
Okay, and more importantly, how's that chest pain doing after that nitro?
It feels a lot better now.
He does feel a little bit better. Okay. You said we were still at 192?
152 over 176.
Okay, it's coming down. And my ETA to the hospital?
You're about 5 minutes out now.
Okay. We're close enough to the hospital, I can hold off on nitro at this time. If I had to give any more nitro, I could give 2 more tablets sublingually every 5 minutes, up to 3 tablets and no more than that. I'm going to move on with the rest of my assessment at this time. We are en route to the facility. I do consider this patient high priority, so we're going to load and go at this time. And we're going to get him to the closest cardiac facility. And continuing on with my assessment, my patient's airway was patent. He was speaking to me. Breathing is doing great now that he has a non-rebreather. Circulation-wise, do I notice any major bleeds?
No, you do not.
Okay. My pulse was present, strong, and regular radially, so I'm good with my pulse there. I want to check pupils at this time. My pupils appear to be equally reactive to light. What do I have?
They're equal and reactive to light.
Okay. There's no need to consider shock at this time. There's no major bleeds that I can see for this patient. I'm going to move on with the rest of my sample.
Okay.
And I got some of my OPQRST, so I'm just going to finish those at this time. My signs and symptoms for this patient, his skin signs, I apologize. What were his skin signs at the beginning?
He was a little bit pale, but he was warm and dry.
Okay, pale, warm, and dry. Okay, so skin signs are pale, warm, and dry. That's what I could see with this patient. He told me he had the chest pain, so right away I wanted to rule in, rule out cardiac-related issues. I treated what I could on scene and went ahead and load and go this patient to the nearest cardiac facility. I got allergies, medications. What was his last oral intake?
He said he had breakfast when he woke up.
Okay, and what were you doing when the pain started?
Walking around the block.
Okay, you were taking a walk?
Yes.
And then as far as OPQRST goes, you said you started about 20 minutes ago?
Yes.
Okay. And I asked most of those questions. Did anything make this pain better or worse for you?
It started to feel a little bit better when I sat down.
Okay. So sitting down made that a little bit better. Nothing made it worse that you could tell?
If I kept walking around, it got worse.
You said that quality was a crushing?
Yes.
And it did radiate down your arm?
Yes.
The severity was a 10 out of 10 on the pain scale, and again, the T for time, it had been going on for about 20 minutes.
Correct.
Okay. My secondary assessment is as follows. I believe this systems affected by my patient at this time would be cardiovascular, pulmonary, integumentary, because his skin signs were abnormal. And we're going to stay there at this time. And we can produce a radio report. Okay. We're going to go to Adventist Health per my patient's request.
Okay.
I'm going to radio to Adventist Health. Adventist Health, this is Hall Baker 123, en route to your facility with the patient information.
Baker 123, Adventist Health, go ahead.
Good afternoon, Adventist Health. Baker 123, EMT Ames, en route to your facility with a 78-year-old male. Chief complaint today was chest pain radiating down the left arm. He is alert and oriented times 4 with a GCS of 15. His history is AFib, cardiac chest pain, no allergies to medications. Medications he takes will be provided upon arrival. I did administer aspirin to this patient, 81 milligrams, orally, times 4 that he chewed and swallowed, as well as 1 nitroglycerin. No more were given because we were close to your facility. Only other intervention for this patient was high flow oxygen via non-rebreather mask, which did increase my patient's oxygen. Initial blood pressure was 210 over 84. At this time, his blood pressure is 151 over 74. My initial oxygen saturation for this patient was at 93% on room air. With the non-rebreather mask, he did come up to 99%. Heart rate stayed pretty consistent around 98. My respirations are 18 at this time. I did not get a finger stick, and I have an ETA of about 5 minutes. How do you copy?
No questions, no order. See you on arrival.
I'm complete with this assessment. So I did my assessment on my sim man, and what they gave me today was cardiac chest pain, which I determined was most likely going to lead into a heart attack. So we treated this patient with aspirin and nitro. What I did not do early on for my patient was check lung sounds. That's one of the things I should have done right away when determining my patient's airway being patent or not. Secondary to lung sounds, I gave 2 medications to this patient. Anytime you're giving a medication, whether it's a easy medication or a hard medication, something that's effective slightly or very strong, you always have to check your 6 R's. And it doesn't matter if it's their own medication or it comes from your first in bag. You want to make sure it's the right patient, you're giving it to them at the right time, right route, right dose, for the right reason, and then you're going to use the right documentation. So make sure to check those R's on every patient for every medication, whether it's their own or coming from your first in bag.